Kalimera, ευχαριστώ πάρα πολύ. Thank you very much. And this is where I leave my Greek, which is not good enough yet to deliver a presentation in your beautiful language. I'll try later, maybe in a couple of years. First and foremost, thank you for the invitation. Congratulations to ΕΛΛΟΚ for a great conference so far. Really amazing, outstanding, I would say, from what I have seen. And also to congratulate you for the topics and obviously to discuss one of the elephants in the room when we come and talk about cancer, which is the tobacco issues, the tobacco policies, and some of the emerging trends which are really extremely worrisome. And if I would be a politician, a father, anyone that works in public health needs to be very worried with this situation because we are losing the war against the tobacco industry. They have come back big time, and if we don't open our eyes and we don't take further action, we are all going to suffer with more cancer and severe consequences in the future. So my first word goes to everyone in this room who has any contacts with the tobacco industry. Don't do it. You work in public health, and if you do it, you have to declare your interest. WHO is very strong on this, and we really condemn the association of public health with anything that resembles tobacco industry. And today is about tobacco and cancer. I will give you some data. I will try to illustrate the situation in Europe, but also let's say, the progress in Greece and elsewhere. And we will give some hints or some suggestions in terms of the next steps. I also know that I'm here between you and we're here between you and lunch, and we pressed with time. We're significantly late and delayed, so I'll try to keep the presentation very short. A lot of the stuff that I'm going to show you already know it, and obviously it's nothing new to a certain extent, but I think it's always worth to remind us. We all know that tobacco use is the biggest preventable cause of cancer, around 25% globally. At least 70 chemicals are related with cancer from the tobacco products. Tobacco is cause of more than 20 different cancer types. Also very important, it really interferes very significantly with the quality of treatment and treatment outcomes. And of course, we also know that novel tobacco products also have very deleterious impact, although of course we need to look more long-term to the long-term effects, but clearly there's nothing which is not, we can consider not harmful. The impacts are very significant. And of course, we still have the issues of those who are exposed to secondhand smoking, and unfortunately, since I've been here in Greece for 5 years, I do suffer from that when I go to places where people are not supposed to be smoking, and unfortunately many of you and myself, we are exposed to that. Therefore, a lot more work needs to be done. The overall proportion of deaths due to cancer that are attributable to tobacco use is between 13 and 41%, and 2 and 21% for women, up to 40% in men, and just below 500,000 deaths from cancer, which were identified in 2023, which is one of the years with more data, with more recent data. And of course, 7 out of 10 lung cancers in men are related to tobacco use. So basically, more than 70%. And also quitting reduces the risk of developing and dying from cancer caused by smoking. So it's never too late, and we should do it. I would also like to highlight the really relevant impact of tobacco and cancer treatment outcomes. So this is nothing new for the audience, but it's really very important that, of course, the presence of tobacco in people's lives when they are diagnosed really reduces the quality of the outcomes and of course, conduces to poor cancer treatment outcomes. It relates with aggressiveness, altering the effect of the drugs, the treatments, and the complications, and also increases, of course, comorbidities, because we know that tobacco is related with cardiovascular diseases very strongly, and of course also with cancer. So it's really very important that we also look into that from a perspective of early diagnosis, treatment, and all of that, very, very important. So no doubt to anybody that tobacco control is critical to cancer prevention. I go back to very old school stuff, and the very old school is the price. Normally, Adam Smith, the father of economy, he was not a public health guy, he said, price always works. And it's normally true in society. So it's very simple, very old slide from France, but you see when you increase price of these very harmful products, you really see a reduction in consumption, and you see a very significant reduction on the prevalence of lung cancer. So it's all there. We know this for many decades. We did a really good job. The tobacco, let's say, policies globally and in Europe under the leadership of WHO are a major success public health story. But we are losing it. We are sleeping, and we need to wake up because the tobacco industry is coming back big time, as I said before. Europe is the worst region in the world, in fact, and in spite of some progress. You can see the dotted lines are estimates, but you can see that our region is the, it's really, let's say the dark, I don't know exactly the color, but it's the dark one there, it's violet or something. And you can see that the European region is really one, compared with other 5 WHO regions, is one which is really not doing that well. We are the second slowest reduction in tobacco use, and we have the highest global prevalence in 2024, 24%. So this is really very serious. When it comes to Greece, you can see where Greece is. We all know Greece is one of the countries with the highest prevalence, is on the top left. So I think the figure speaks for itself. This illustration is more than enough, and Greece is together with some more Eastern European countries in the EU, and therefore one would expect that you would be in a slightly better position at least. So the prevalence is very high, way above the EU average, so we have to do much more. In females, the situation is extremely worrisome because progress in the European region is not as good as in other regions, and therefore, of course, although normally men smoke more, the preoccupation with women has to be there because it's really very serious, especially when it comes to vaping. Obviously, all of this translates into impact and into general outcomes in terms of NCDs. We are not only talking about cancer. Obviously, the connection with cancer is more than clear, but we're also talking about cardiovascular diseases, diabetes, and other, and you can see that tobacco there at the top is clearly the main risk factor in terms of attribution of chronic non-communicable diseases. So I also understand that this is no novelty to any of us, but it's also a call to action, and really, although progress obviously is there over the decades, we're at a, I would say, crossroads where progress can be lost if we don't do more. Different way to present the data on consumption, men and women, the different, of course, types of diseases, and what I would like to highlight here is that we're not only talking about cancer, but also talking about especially cardiovascular diseases and others where tobacco has a huge impact. And again, you can look at the situation in Greece compared to other countries. Greece is really one of the countries with the highest negative impact of tobacco products. We also believe that we need to focus more on young people, and why? Because we have a big challenge, particularly with the novel tobacco products. We have a significant group of adolescents which is engaging with these new products. There's a risk of addiction to nicotine, as you know. We have the deleterious effect of all the products that we know are negative in these products. And of course, we have a serious concern that these products are really reversing very big success in tobacco control policies globally. And also we need to continue to look into long-term effects. So basically, we really need to be, as we are looking into tobacco policies overall and the need to reduce the consumption in all groups in the population, I believe, we strongly believe, that young people deserve a very special look because the consumption of these products is very, very high. And Greece is no exception. On the contrary, Greece is one of the countries that is suffering more from novel tobacco products in young people. This is the statistics on the prevalence among all reporting countries, as you can see, and you see that flavors are often cited as the #1 reason for young people to start using these products, and there's really a very significant impact when it comes to young people. So you see that in terms of e-cigarettes, novel tobacco products, Greece also pops up as being at a leading position. And if you look at the ESPAD last data, which is a survey that looks at substance consumption in young people across many countries in Europe, and you would see that there's a sharp increase in the last decade, more than triple in the last, let's say, more than 10 years. And Greece is actually following this upwards trend, but if you look at the EU countries, Greece is the country in the EU with the most significant increase in novel tobacco products, and including e-cigarettes. So it's from 35% to 52%, so it's really going up very, very quickly. And it's a very serious situation, I would say. Here, a different way to present it, and again, you see a comparison that brings together the situation in Europe, and of course, you see the increase basically in several years, half a dozen of years, you see a huge increase, more than triple the consumption of these products. So it's not that these products are being used for people who are already smokers to help them quit smoking. Let's be very clear. This is not the case. These products are not being used as a risk reduction strategy. This is a complete lie. Young people are using it. They shouldn't be using it, right? And very young people, 13 to 15-year-olds in many cases. So the tobacco industry is expanding their number of clients, is targeting younger people, and is targeting especially women. So let's open our eyes. This is not a harmful reduction approach. This is enlarging the market. This is a huge success. This is a big comeback. We all should be very worried with this. You can see a different illustration. Only 3% of adults, more than 1 in 5 young people. So who is using novel tobacco products? That's the question. The data shows it very clearly. Let's not ourselves be fooled. Pouches the same, we go ahead. Heated tobacco products is the same. Consumption in Greece is also a little bit high. One of the things that has been, let's say, a great success, unfortunately, for the tobacco industry is that with new products and social media, they've been sort of able to advertise in a way that it was not possible before. So we all know this. Influencers, just an example of things that are happening that they shouldn't be, and where we as public health officials, we need to advocate for stronger policies and legislation. New and emerging products, sleek and trendy design, discreet design, bright colors, cartoon characters, apparently designed for children. So certainly I don't see it as products designed to help people quit smoking, those who are already smokers. I think it's a different story here. So we really need to take action and be very smart in terms of what we are doing, because there's a long history of misleading science and youth targeting marketing. There's aggressive promotion of these new products. There's the use of flavors, colors, and design attractive to youth, systematic interference with public policies, including strong opposition to regulation and taxation. So everything that works, we of course are being challenged. So there is a European context where we would like to promote and where we would like to propose further action in face of the current situation. I'm not going to go into the detail of all these elements, but just a summary, and I'm very happy to share the slides in case you would like to have them, but this is the current situation we have in Europe, and therefore this is certainly an area that still deserves a lot of attention from public health. We also believe that in Greece we need more action, and we are ready to work with the different colleagues in developing and enforcing these policies. Where we see that could be a little bit of an improvement is on the enforcement, because I will show you another slide. Greece, in terms of legislation, is quite okay compared with other countries. Some areas need to be improved, but enforcement is something really serious. The regulation on the novel tobacco products is also important, and of course, protection from interference. Because what works is very clear. What works is comprehensive smoke-free laws and strong enforcement. When I go out with people in my office, sometimes I have a lot of young people, and we go out for a drink. I do it sometimes. I go to places, everyone is smoking inside. It's not allowed in Greece, but people are smoking in bars and discos, wherever you go here. But it's not allowed. So there's a matter of enforcing, it's very important, and you don't see that in all European countries. There are many European countries where you cannot smoke, because if you smoke inside, the police comes and your establishment is closed. So there's many areas where we can improve. We need strong leadership. The leadership starts with advocacy, with organizations like this one here, and starts with public officials and public health policy, public health people doing what they are supposed to do. Then it's about really implementing the WHO Framework Convention on Tobacco Products, and we will get done. But as I finish, just to say, and I'm ready, that really we are worried that we may be losing this war, and we really need to go back to the drawing boards and go back to really very strong public health policy that we had decades ago in Europe, and we really need to be proud of that success, but we cannot really rely on past successes. We really need to keep our eyes very open, public health working together with government so that we avoid the negative impact of the novel tobacco products and, of course, of tobacco in Europe and in Greece. Thank you very much.